We need to talk about social care because, frankly, our politicians just aren't. Social care is that umbrella term for all forms of personal care and other practical assistance for those who need extra support due to physical or mental conditions. It's what's known as a devolved responsibility, so today our discussion is focusing solely on England. Distinct from primary healthcare, the treatment you receive from your GP or in hospitals or outpatient clinics, it's paid for either by the individuals receiving the care, local authorities, or a combination of the two, and therein lies the issue. The social care sector is massively underfunded, understaffed, and still recovering from COVID. So many people find themselves using their life savings, selling their homes and their possessions, just to ensure that they or their loved one has the care they desperately need. 4 out of 5 of us will need some form of social care at some point in our lives, and yet reform hasn't exactly been a prominent issue at this election. I'm Niall Paterson, and on this edition of The Daily, I'll simply be asking, why? Well, looking rather more deeply at this story, our political correspondent, Rob Powell. Rob joins us on the podcast. Look, Rob, whenever we are doing a story of this type, we often look for what we call case studies. We want an example, a pertinent example of people in the situation that we are discussing. And frankly, in Norman and Roz Phillips, you found an example and a half. Tell me about them.
Yeah, it really, all the various aspects to their, pretty tragic story in many ways seem to sort of tease out so many of the difficulties that are present within social care and the NHS more broadly at the moment. Now, Norman and Roz, or Rosie as he calls her, they've been married for over 50 years. They live in Stevenage in Hertfordshire. Now, she has multiple sclerosis and dementia. She was diagnosed with dementia quite a few years after the MS diagnosis. At first, they were sort of making things work, but as the MS essentially got more debilitating, Norman found that he would essentially have to become her carer, and they struggled with costs. They had to sell their home.
Never trust a doctor with percentages, because they'll say to you, 85% of the people that get this live a normal life, relatively normal life. Yeah? And that's all right if you're in the 85%. But poor old Rosie has never been, she's always ended up in the few percentage points where things have got bad.
To begin with, you were managing, I guess, being a carer with working.
Once she turned 50-ish and she started to need care, right, I started getting people in to do the housework. Yeah, but Rosie could cope with all that. Then we had a serious downturn and her cognitive function was a bit iffy. And the stress and strain of trying to work and trying to manage people to come in, or having to ring a boss up and say, look, I'm terribly sorry, but I've got to turn around and go back to Stevenage because I can't find anyone to go in and look after Rosie. And for a good while, that was tolerated because I always got the work done, but then it went a bit pear-shaped and and then, as I say, I collapsed in the street and it just became obvious I couldn't do both, right? So we had a decision to make. Either Rosie went to a nursing home at that stage, and mentally she wasn't ready for that, and nor was I. So we had to make a decision, leave work, right, to become her carer.
But if you're unfortunate enough to have something where you need more social side of care, you end up, I guess, having to spend a lot of your own money and not being able to pass your own money on.
Well, I mean, my kids learned a long time ago that their inheritance has gone, right? Because everything's, we don't have any money left. Yeah, we didn't have any money left a while back. Had I known what was going to happen, I'd have been more careful, but I was anticipating, because I've always been an optimist. So we ran into that little problem, and then so we had to let the house go. And everything I heard from all the politicians has always been, well, you won't have to sell your house. Well, hang on a minute. I'm not worried about selling my house, right? Before I even get to that stage, where's the workforce that's going to deliver that? Now, I'm not asking the system to do all the work I did, right? But just bear in mind that no one can work 7 by 24, go 3, 4, 5 nights a week without sleep. And you get the consequence of what happened to me. I fall apart.
What's the core root problem then, why this system doesn't work?
For me, fixing the NHS isn't the answer, right? They've got to face up that they need to fix social care. And they've got 6 million of us unpaid carers, right? If they help us, we can help the system, right? But as what's happened to me, where the system just kept backing away, until I cracked. Yeah. And I say, you imagine 10%, if 600,000 people were suddenly not able to do the caring, where would they find the workforce to do that? But talking about fixing the NHS, it just shows to me they're either completely failed to understand what the problem is, or they're not being honest, that they can't fix it.
First things first, Rob, we should say a very big thank you to Norman and indeed his wife Rosie for letting us into their life and for the candour that Norman has displayed. But you got, I think, a flavour of the depths of despair that man has found himself in just that brief snippet of your conversation. This has been really, really tough on him.
Yeah, he's angry about the state of the system, but he says you can't be bitter in circumstances like this. In February this year, Norman basically had a breakdown, and he says a result of that, Ros now has quite a substantial care plan put in place, but that's a care plan that's provided by the NHS, so she's under what's called a continuing healthcare plan, because essentially they looked at all the various needs that she had and what Norman could provide as a carer, and decided that he bluntly wasn't able to care for her because of all the stresses and strains and the complex needs that she had. Now, she now gets pretty much round-the-clock care every single day. Now, Norm describes this as a bit overkill, as he puts it. He said that, he doesn't necessarily need all of that. It's costing the NHS hundreds and hundreds of pounds, thousands of pounds. He said what he wanted was, years ago, just a little bit of help so, he could sort of have an afternoon off on the weekend, or have some time off overnight, some time where he could walk the dog or go for a coffee. And he said if that had been put in place, which would have cost the state a lot less, they wouldn't have ended up in this situation. Then the NHS wouldn't have found themselves, and the state wouldn't have found itself in a position where they're paying a lot more because they've allowed this to get to breaking point.
But he will not be the only one, Rob, I'm presuming, that has found himself in this situation. Look, before we get really into the long grass in this, and there is so much to discuss, let's go back to first principles. Social care. What is it? Who pays for it? And how does it intersect with the health service right now?
Well, essentially, if you're diagnosed with cancer, you have a primary health need. It's one of the principles of the NHS that, your care's not free. We all pay for it. It's paid for somehow, but it's free at the point of use. Now, if you have needs that are not so acute in a sort of primary health level, but you essentially need, care in your own home, well, that can be paid for if you have a lower level of assets. If you don't have savings, that it's local authorities that will provide for that. If you need to go into a care home, local authorities will provide for that as well. But the floor on that, is quite low. You're talking, I think it's around £20,000 or so. So if you've got a home, if you've got assets above that, you're paying for it yourself. As Norman said in our interview, he sort of went to, when he gave up his job, he went to the authorities and asked what help was there. And they said, well, for the amount of assets you've got and the wage that you're earning and the pension you've got, you're a self-funder. You start paying for it yourself. And that's really how, as conditions can worsen, you can start racking up huge bills. Now, there are options if you go into a home to pay for that from your estate after you pass away. But what it essentially means is people can rack up hundreds and thousands of pounds of care costs, which ultimately eats into life savings, eats into assets like homes, which means that you can't pass that money on to your family, which is exactly what Norman Ros found.
I suppose, though, there would be those who suggest that, look, if you are in the position, the lucky position of being able to hand on assets to your children at the time of your death, then why shouldn't you contribute towards this aspect of your care?
Yeah, and this is the difficulty, right? Because even if you're getting social care paid for by the state, the money's got to come from somewhere. So what you're essentially saying is, rather than the person that is receiving the social care paying from their own assets, it's shifted on to general taxation and we're all paying. But that is the system that we have as in the NHS, right? It's a sort of pooled risk basis. So I think what people like Norman and other people, like the economist Andrew Dilnot that came up with the care cap proposals can't wrap their head around is how you have one system for the NHS that is for free at the point of use, done on a pooled risk basis that everyone pays for through taxation, whereas you have something like social care, which is so different. But I think what's interesting, when you talk to Norman, he says, look, I don't mind about selling my home. He goes, that's not the sort of issue here in his mind. The issue here is just getting the care in the first place. So it's about workforce. It's about councils having enough money to give to care homes to pay for workers to come in. So it's the actual care being there in the first place, rather than necessarily who pays for it.
And that is, of course, the other aspect to the care sector's story, so to speak, is that this is a sector in which pay is pretty low, where it is incredibly difficult to recruit, where retention is a big problem in terms of care home staff. But look, I mean, you've mentioned his name already. Sir Andrew Dilnot was tasked with working on this in the very early days of the Conservative administration back in, I think it was all the way back in 2011. So what happened to his recommendations?
The key one he made, one of many, was for this idea of a care cap, so no one pays above a certain level, and that eliminates the prospect of these catastrophic costs that Norman and Ros have experienced.
So it's around about £86,000, I think, was the cap.
That was the level that was set by Boris Johnson when he brought it forward, but it's sort of varied in different proposals. Now, that was adopted by David Cameron initially. It was put through in legislation. You know, Andrew Dilnot says this proposal has been given royal assent twice, once under David Cameron, once under Boris Johnson as Prime Minister. But then that was shelved in about 2015. It was shelved on cost grounds. I think the Cameron government said, you know, we needed to sort of have a degree of introspection about whether now was the right time to be spending all of this money. So that was kicked into the long grass. In 2017, Theresa May had a go at it in the election manifesto, but I think the policy as she presented it, initially anyway, was somewhat flawed because it didn't really seem to initially anyway have that cap in it. She insisted it did, which is where we get the nothing has changed moment from, and that basically kind of created her campaign at that point. I think at that point, 2019 manifesto comes along, and I remember acutely having a conversation with a very senior cabinet minister who was in here at the time of that election campaign, rather gleefully gloating about how, in his words, the social care policy was completely buttoned down, and showed me the page of the manifesto before it had been published. And what he meant was there was nothing to it. You know, it essentially said people won't have to sell their homes to pay for care, and we will consult cross-party to find a long-term solution.
And we're now going into an election where, in the Conservative manifesto, there is a few lines of waffle about what we are to expect the other side of July the 4th if this government, which has been in place, let's not forget, for 14 years, gets another go at it.
Yeah, well, I can tell you how much is in the manifesto. I've got it here. There's about 2 paragraphs, which does say we'll implement our plan reforms to cap social care costs from October 2025. But, you know, look, there's more about national service in this manifesto than there is about social care. And I mean, sadly enough, Labour is not that much different. That doesn't even, in the manifesto, commit to the cap coming in 2025.
Thanks, Rob. When we return, much more on why our politicians seem hell-bent on, if not ignoring social care entirely, then certainly not giving it the attention it requires. Back soon. Welcome back. Rob, we were just talking about what the two major parties have in their manifestos about social care. Safe to say, not a lot. 2 paragraphs, count them, from the Tories. And in my reading of the Labour manifesto, over the course of the next decade, a national care service will be set up. So why are politicians not dealing with this issue, discussing this issue with the requisite level of seriousness?
The answer that Andrew Dilnot gave to us about that is that there is a bitter election battle going on about tax and spend, about how much money you'll be spending and what that means for the tax rate. And I think both parties are very, very nervous about talking about things that will need a lot of money to fix. I think they are scarred or wary of what happened to Theresa May in 2017 being repeated again. And I think that's why this is happening.
How is that possible? You've got a Conservative Party that's 20 points behind in the polls. If they wanted to do something eye-catching, here's an opportunity for them. You've got a Labour Party that is 20 points ahead in the polls. They can lose. They can lose a few seats. They can lose a few tens of seats, I would argue. So why can't they be bold enough to put this in the manifesto?
I think it maybe taps into, you could argue, a kind of broader societal issue in the way that we approach issues to do with ageing, approach quite in many ways, kind of dark and bleak topics like this. We don't like to think about this stuff. We don't like to think about growing old, growing frail. We don't like to think about, incontinence and all the stuff that comes alongside that. So, I mean, maybe the answer to why politicians aren't sort of taking a stand in this election and talking more about this is that they sort of perceive that society isn't taking this seriously enough, that people more broadly aren't taking this seriously enough. So they'd rather focus on other stuff where they think votes can be won.
Can I be more cynical than you, Rob, and put it like this? I'm wondering if the reason that both Labour and Conservatives are behaving in this fashion is that there aren't votes in care homes. Simply put.
I think as an issue, they perceive it electorally as more to lose than more to gain. And I think that's really sad, because the other reason I think that it's a sort of short-sighted way of thinking about it is that until I started talking to people about this for this piece, I don't think I'd quite grasped how enmeshed the crisis in social care is with the crisis in the NHS. Bring it back to Norman and Ros. He talked about one year where she had to go into hospital 16 times. She spent 90 days in hospital. She had 9 MRI scans, 16 emergency ambulances, countless more CT scans. And every time she went in, people worked hard to try and figure out what was going wrong and discharge her as soon as possible. It turned out after all of these hospital visits that what she needed was a 5-pence pill, and that's kept her out of hospital since. And his belief, and I think there's something in it, is that if you had a more stable, sort of less fragmented system of care around her, that solution would have been picked up more quickly. It would have kept her out of hospital, and then in turn that would have freed up space with GPs in hospitals for people that need elective emergency procedures.
Do you think that people genuinely just don't understand the relationship that exists between the health service and social care? The reason that there are so many, what used to be called bed blockers, absolutely hate that phrase because it implies that there is some fault on the person in that bed. There is not, but they are stopped from leaving hospital at a point at which they would be perfectly capable of doing so, were it not for the fact that the social care just wasn't available for them to allow them to leave that primary clinical environment. Do you think people understand this symbiotic relationship between the NHS and social care?
I don't think so. The two are completely interwoven. And when you look at the statistics about, people that are in hospital beds but fit to be discharged, it's just under 14,000 people per day were in beds in England in February this year when they were able to be discharged. Now, not all of that will be because the care settings aren't there for them to be taken to, but that's 14,000 beds per day in England that could be taken up with someone, on a waiting list that needs an operation. In Croydon, which is the worst affected area according to these stats from NHS England, 1 in 3 beds was out of action because of people that weren't able to be discharged and weren't able to leave. That costs, I think the estimate is just under £2 billion per year, the King's Fund put it at. So if you don't suck the demand out of the system, then you will keep pouring money into the NHS, and it will be eaten up forever, because this demand will always be there, because we've got an ageing population, and because needs when we're getting older are becoming greater over time.
You mentioned the politicians there. You, of course, have been travelling, I think, primarily with the Conservative team. And what have you heard directly from the man who would be Prime Minister again?
But not a lot, I'll be blunt. A few days ago, we were in Suffolk at Sizewell B power station, nuclear power plant, and we had what they refer to as a huddle with the Prime Minister. I said, is the care cap still on track for 2025? Could there be any more money for local authorities to help with, pay for carers for care homes as well? And he essentially said, well, when I first became Prime Minister, we put billions of pounds extra into health and social care. We've done a lot of work to try and join up social care and the NHS. And yes, the pilots on the care costings are all on track. So that date, which he couldn't quite recall at the time, would be hit in October 2025. So, it's sort of, he was focused on a different story of the day, I guess. But, there has been some reporting that, Rishi Sunak, even when Chancellor, the reason why that health and social care levy, the increase to national insurance, was forced through was because he was very keen to kind of show Boris Johnson that if he wanted to try and fix this, then there had to be a trade-off, that the money needed to come from somewhere. And actually there was a degree of scepticism around the Chancellor, around Rishi Sunak at the time, about whether the state should quite be putting up so much money to essentially protect the inheritances of people that may have quite valuable homes. So look, you can see why people are being a bit sort of suspicious and cagey about having this being kicked past the next election, whether it will come into force. As for Labour, again, they've talked about a national care service within 10 years. They haven't even put that date for the cap in their manifesto. I guess the thing we should say on this is that the reason why the delay was made, in part, was because local authorities and councils were saying that they didn't believe they were in the right place to be able to fulfil this. So there were technical reasons. But again,
that was quite some time ago.
And that also speaks to some of the faults of the last 14 years or even longer, decades of inaction over actually tackling those systemic issues over workforce, over the amount of money that's needed to go into this. The reason why the sector wasn't in a good state in order to provide this care is because no one had fronted up to those more systemic challenges outside of the care cap. So you just get horrible visions that will be sat here in 10 years' time discussing this again, having nothing been done.
Rob, many thanks. There's a word often used when talking about social care: dignity. That people with conditions requiring extra assistance should be treated with dignity, with respect for their individual circumstances and needs, never forgetting that they are not simply the sum of their ailments. And I'll wager there isn't a politician standing for election that would, if pressed, say any different. Yet neither is there an abundance of politicians willing to talk openly and in detailed terms about the huge efforts that will be required to make social care work. As Andrew Dilnot has said, 4 in 5 of us will need social care before we die. We need to grow up and talk about it, for there is nothing dignified in pretending otherwise. That's your lot for this edition of The Daily. We'll see you again next week.